So priority 5 is increase all forms of accessibility to healthcare services and coverage. Accessibility is essential to obtaining necessary and appropriate care and services, particularly for people with disabilities. The CDC estimates that 1 in 4 American adults have some form of disability, including related to mobility, cognition, independent living, hearing, vision, and self-care. Rates of disability increase with age, with 2 in 5 adults over the age of 65 reporting a disability. These rates are higher among racial and ethnic minorities. Individuals with disabilities are more likely to experience higher rates of chronic conditions, including obesity, heart disease, and diabetes. They may be more susceptible to infectious diseases such as COVID-19 than individuals without disabilities. In addition, emergency and disaster readiness efforts must ensure that plans are disability inclusive, and state health agencies, healthcare organizations, and communities are collaborating to understand the barriers individuals with disabilities may face during an emergency. This includes preparing for mitigating and overcoming challenges together so that disparities are not caused or worsened. CMS has responsibility to ensure that individuals and families are able to access healthcare services when and where they need them in a way that meets individual needs and preferences. No, I would agree. I really think it starts at knowing the patient and knowing who your population is and not being satisfied with just looking at overall data. It's something that's more general, but really getting to know your patient population and doing outreach. I know that there are a lot of groups that are doing even, screening surveys today. And I think that that type of work is important. Um, you know, doing doing outreach to patients, making calls, and then engaging them. It doesn't even have to be in a call, right? It could be just even outreach. I know sometimes individuals will do it during the annual wellness exams for our seniors, or it could be part of the visit in the physician's office. I'm a big believer in motivational interviewing, and I think that we could do a lot more than handing out papers to patients to fill out prior to a visit. A lot of times we think of that activity as being something that is time consuming. And I understand that it may be for the physician or the clinician, but I think that others within the office could be brought to bear to do that motivational interviewing to better understand who their patients are. And not from the standpoint of, just your health history, but asking more of those probing questions so that you could really understand and get at where there might be challenges. And I want to remind everyone too that not all disabilities are, apparent. A lot of times we make assumptions about people and we don't understand what challenges they may have. And so I think being able to do that to that level of interviewing is really important, so that you can, again, better understand patients. Because I think it's alarming, right, that not only are they challenged with a disability, not only is that disability and we recognize mobility, cognition, but even health literacy is a component of that. And so the challenge of having the education to better understand what it takes, right, to be healthier, and then knowing that chronic conditions are more prevalent among those populations as well. So more prone to have diabetes or, cardiovascular disease, again, I think is concerning. And so if you're not getting to that level of really understanding who your patients are, I think you're really missing out on an opportunity to connect with them in a way that is meaningful and will have impact. Great question, and I'm glad that you brought it up. When I think about fee for service, it's really the patient shows up, they show up at their needs and have, you execute the appointment and they go away. And if they need to see you again, then they come back. It's very transactional. When I think of value-based care, I think that a connection is required, because if you think about it, there's really, in my mind, I think of 3 components to value-based care, and that is prevention. So what can you do to prevent conditions from either happening or you know, disrupt the traditional trajectory that one would expect a particular condition to go. So doing things like making sure that your diabetics are getting their diabetic retinopathy screening, or that women are getting their mammograms on a, on a regular basis, or, patients are getting their colorectal screenings. So those things that would intend to keep them healthy. And I think education becomes a part of that too. And then the other component is capturing those conditions that a patient has. And so thinking about, the disabilities that we talked about, which are important in documenting risk, as well as any particular conditions, so that you're aware of who your patients are. And then total cost of care, right? So a lot of even the quality measures are such that if you know your patients, you should do everything that you can to prevent them from becoming exacerbated and requiring, say, an inpatient stay. And so, to the extent that you can manage their condition at the best site of care, which also includes the lowest cost, right, and hopefully the lowest intervention, but still maintains positive health outcomes. And so when I think about value-based care, it really encourages it, it's not that one for one visit. It really encourages the physicians to have those connections, or clinicians to have those connections with patients, for patients to have those connections, and to be actively working and engaged. That's what I think value-based care brings. Because again, fee for service, you go to the appointment, you're done, you leave. You don't know if the patient really does what they're supposed to do. But I think value-based care engages us more in the relationship in a way that we have at goal, not necessarily treating symptoms, which is what I think fee for service does, but being proactive and actually managing the condition on the whole. I do. So I know that telemedicine, I know, is something that is looked on to be very favorable by our decision makers. And I think that it definitely added to or increased the ability to access. And so when we think about mobility, or even cultural differences, I think that telemedicine provides a lot of opportunity for physicians to be able to still see patients. And what I envision a model becoming, and I know that some are putting this into practice, but knowing that we have a shortage in this country of physicians, especially in primary care, which is unfortunate. I think what we're going to see is we're going to see more medicine delivered via telehealth. I see also too nurse practitioners and physician assistants being enlisted to help in some of those models, and physicians or even specialists being brought in to do more consults, if you will, and provide supervision. But definitely think that telemedicine improves access to care, but also I think addresses our need to have qualified health professionals being able to care for these patients. Because as people get sicker, that's the thing too. As we become an older population, not necessarily healthier, so we're living longer. Medicine has done amazing things to help us live longer, but that doesn't necessarily mean that habits have changed. And so I think that, the prevalence of chronic conditions still exists, and potentially continues to worsen. And so with the shortage of qualified healthcare professionals, we need to find ways in which we can still care for this population. And I see value-based care and then telemedicine too, and the technologies that we have being a way or a mechanism in which to do that better than what we could have done on the traditional model that we had, say, prior to telemedicine being more accepted. Definitely, I definitely think that VBC is the way to go. as I had shared, I think there needs to be a paradigm shift from being reactive in treating symptoms to being proactive, especially as we know medicine continues to improve. And as I shared, folks are living longer, but with these conditions. And so, how can we improve health overall if people continue to, live longer with more chronic conditions? It takes more to care for those patients, obviously. And so, to the extent that we can improve health, I think would be beneficial overall, right? Healthy people or happy people and engaging in society are, providing benefits as well by their participation and interaction. And so, to the extent that we can, I really think I said it was a paradigm shift, but it's in that idea of being proactive, but really taking on not necessarily focusing on the individual. I mean, you're still focusing on the individual, but looking with a wider lens, if you will, at the population overall, and population health becomes important. Absolutely agree. I think that there's a lot of facets of technology that one can look at, not only about bringing data together and capturing that information from different areas where a patient may have accessed healthcare, being able to share research and the latest and greatest on developments. you know, there's those components, but then there's also, as we mentioned, with telemedicine, so being able to connect people over camera and be able to have those conversations with one's healthcare provider, being able to look into the home, the data that you're able to gather there to understand a patient just by looking at the condition of the home, whether there's fall risks, you can peer into the medicine cabinet. There's a lot of capabilities that I think telemedicine provides. And you can still get a lot of the ability that you had when a patient was in the office. You may not be able to lay hands on the patient, but you can still do, a visual survey of the body and be able to talk through things. And then I think also other things that are amazing are just even the technology around diagnostic devices and devices, remote patient monitoring, and devices that can be sent into the home. I've seen some pretty amazing things where there are devices where you can track for irregular heartbeats to looking into the ear to looking down the throat of a pediatric patient to being able to check for fever. In traditional remote patient monitoring, getting reads from digital scales when the patient steps on it, every morning. I just think that there's a lot of ways in which technology can be brought to bear to help the work that we do, and want to encourage folks to be curious and open as to what technology looks like. Because like I said, there's a lot of different options. And so having that wide view uh, that would include all different types or components of technology, and not just those that help us say, back on the administrative side of healthcare, but then also to being able to help with patients and, better understand, their circumstance and their conditions.